just click add. Now it's showing up there, and then the plan. I could type in everything I told the mom to do, but one of the good things about otitis media visits is that there's a macro for it. You don't really have to do much typing. That would not show up on the child. You can ignore that. Okay, so in the macros, we go down and we find otitis media. Here, and it brings up a nice plan for you. And when you click save, because otitis media AAP handout given is one of the things, it automatically brings up the PDF for you to print out and give to the mom. Now, let's say we prescribe this child some amoxicillin, or we're going to. Remember to put your auto expire so that you won't have amoxicillin in her drug list once the 10 days are up. And she's got amoxil on her allergies, so it's asking me, do I want to continue? And I just will. And we've shown how to print one in another lesson. So now, as we've gone through and done all these things, we can look at our document and we see that we've pretty much just generated our whole note. The history that we typed in is there. The past medical history, which we reviewed, is there. Her allergies are listed, medications. The social history that we entered is there. There are no vitals, but there would be if a nurse had taken vitals on that patient. There's our exam. Our assessment of otitis media shows that we gave the amoxil, and then all the counseling plan that was part of the macro. The follow-up is in there. Attending notes in there. This note's ready to save. So we bill the visit, E&M billing. Based on what we put in there, it's a level 3. We were probably pretty close to a level 4. It may have actually been a level 4 if you keep in mind that I typed in the freeform, the HPI in the freeform field, which means that it doesn't count towards the computer's automated level of service generator. If I had used the trees for the HPI, this might bill out to a 4. So I'd have to consider that. But for now, we'll just bill the visit at a 3, with that being what it came up. I like when I pull up this unwieldy list here, the first thing I always do is hit an R because it's the first letter of rodent. I don't have to scroll so far. And there is Dr. Alexander's name. I can, when it's highlighted like that, I can click it, or I can just hit tab. And it'll go to the next field, and the one that we just came off of will be, we'll have selected whatever it was on right before I hit tab. So we're ready to save this. And now we're ready to save the document. Click Save Document, select E&M Family Medicine, and then we'll select Dr. Alexander's name so that it'll send her a message saying that she needs to sign the chart. Then I will sign the note. This is my last chance to make any changes if I want to. If I do want to make changes, I can click the Enlarge button, and go down and make changes wherever I wanted to make them. Then click Save to Chart. Then I click Sign. I enter in my signature code, and it'll say there, document is signed by Roden John. Okay. Now, in another lesson, we'll talk about how to do a visit that it's very useful to use the trees for the history and the exam, but that's it for this visit. Okay, in this section we're going to go through another vignette, this time with a patient with some chronic problems, and we're going to see just how well the EMR can function to save us time when we're doing a note on a patient who's in every 3 months with the same issues. And we basically take the same history every time in the exam room. We do the same exam, do a lot of the same things. So in this particular case, we have a fake patient, Martha Mouse, 53 years old, has hypertension, diabetes, and hyperlipidemia. And let's just say that in our visit, everything was controlled, and all we did was refill her medicines, and we're going to order her labs. And we'll go through and do all those things at once and generate the note as we're doing it. So let's go to physician office note adult, and we'll choose any one of her 3 problems. I'll choose hypertension. Keep in mind that this patient would be someone who I have seen on a regular basis in the past, and her information is going to be in the trees because that's where I've entered it in the past. So let's go to history. Again, I always do my attending note in the history just to get it out of the way. Now let's just go to history of present illness. This is where I've entered it in the past. Say she was here 3 months ago, and so all I have to do is click last visit. All this stuff is the same this visit, so I don't have to type in anything with regards to her hypertension. Now, for her diabetes and her hyperlipidemia, those trees, now that I'm inside the hypertension tree, are going to be found under other. And so we can go to dyslipidemia again, last visit. Let's say all this stuff is still the same. And diabetes, last visit. Let's say that lately he's been checking it only once a day. Make a quick change. Just change whatever. The point is to change whatever needs to be changed, but most of the stuff on these type patients is going to be the same every visit. So you have the benefit of clicking last visit. And now you can see, I'll just pause what we're doing here and show you. We've got the entire HPI for all 3 problems filled into our note for us. No typing necessary. Now let's say we want to include family and social history and review of systems in this note. Again, if it's already in there, all you have to do is click on it to make it show up in the note. Here, obviously, father MI at 60 is pertinent to this type visit. Social history is important to click on this type patient to include in the note, especially whether they smoke and drink alcohol. It's already in there. So we're just kind of clicking through this patient's chart and populating our note without having to really do any real work. And on review of systems, on this type patient, I always do essentially the same review of systems each time. Find out if they're feeling well overall. And cardiovascular and endocrine are already part of the HPI. Endocrine being counted as the diabetes and lipid disorders. So now we've got an HPI, a review of systems, past medical history, a social history, a family history, all populated in the note, and we haven't really hardly typed a single thing. So we're done with the history, and we probably have a level 4's worth of history put in there. Exam, again, on this type patient, I pretty much do the same exam every time. Just click last visit. If all this stuff is the same as last time, great. And if it's anything's different, you can just change that one thing. Under assessment, let's go in. Let's say all 3 things are controlled at this time. We always have that long-term use medication diagnosis on people who have issues like if they're on a statin, so that we can get the CMP. That's a diagnosis that'll pay for a statin. So let's just say that we're I don't know, let's say that their hypertension is uncontrolled, that their blood pressure reading was high today, and so let's say the diagnosis, the diabetes is controlled, and the hyperlipidemia is controlled, and long-term use of medication. I need to activate that diagnosis so that I can order something using the diagnosis, and by default it's listed as not treated, so I'm going to change it to unchanged just to make the diagnosis active so that when I get into the ordering program I can actually use that diagnosis to order the CMP that I'm going to want, since she's on a statin. So now I've updated all my diagnoses, and you'll see that now my note is populated with all the history stuff that I looked at and clicked on, the entire exam that I clicked on, and then all the assessment will be the issues that I've now updated on the diagnosis list. So we just need a plan. Part of that plan will be the prescriptions, and let's say the glucophage and the Zocor, we're just going to refill the same way they were last time. So we're not changing those. Let's see how many refills we gave them last time. 5 refills. I'm going to give them 5 refills again because they're stable, so I can just click same refill on both of them, and they're once